I want to thank all you present in this webinar of a Euro-Mediterranean Medical Informatics and Telemedicine Group and the International Telemedicine and Medical Informatics community. The topic of this webinar is about the cooperation in digital and global health between countries, between European country and Mediterranean countries, and all countries at international level. We start this webinar giving the speech to Professor Pellicano about the situation of digitalization and the ICT application and the standard and the rules in the European Union. And after I asked to Professor Samayad to speak about digital pathology and the need for artificial intelligence in medicine, and Emilia and the other people, Claudio De Felice, and so on.
So thank you to Professor Sigorello to invite me in this session. And we agreed this morning to speak about a very important topic in this moment, that is, which is on the attention of the European Council about the so-called 2030 digital decade. It means that European Union decide to improve the digital skill of the people, we can say, in order to reach in 2030 the best results is that will be possible to spread the digital competences among the peoples. And this is a European project. Each country is moving by themselves, of course, but we have to consider that this will be a problem for all European countries. So we can do some studies about the different situation, but we have to consider each country at which level is in this moment. And of course, we have analyzed the Italian situation, and we know that in this moment, the digital competences in our country is very low. We are not alone in this problem, but we can say that only the 46% of adult people has digital competences at a good level. And so there is also a small quantity of people in order of 5% that is completely totally indifferent to this problem. And the trend from the 2021, when this project started, is not uniform. There are countries that move much more fast than others. But since we want to analyze the Italian situation, we can say that the most important topic or the most important features that create digital competition, of course, is the instruction. So, for instance, people that are graduated at the university level has digital competences in 74%. And this could be obvious, of course. But the same high rate of people with digital competences in other countries is spread among people that are not graduated, or not only this. So the difference between Italy and other countries in this case could be very high. Another very important topic is, if you have digital competences at good level, will be much more easy to obtain a work, to participate also to the democratic life of your country, or to come back to work if you have lose your job. So this is a very crucial point. And this is also organized in a national plan for a national strategy to obtain digital competences. It means a lot of things that we have to do in order to create new people that is very skilled, not only as 10 years ago in the field of information technology, but today, of course, in the field of artificial intelligence. And we expect in the European Union to have 20 million of ICT specialists. And of course, another important topic is that among these 20 million people, there must be the same percentage between women and men. So also the gender gap is another problem that we have to consider. Of course, to obtain these specialists, we need to make instruction, especially instruction. And we know that almost, not only in Italy, but in many countries, there is this skill mismatch between people that have the digital competences and people who have not. And another particular number is which percentage of specialists in ICT we have in people not older than 35 years. It means that the most skilled people is, of course, under this age. And the problem of the gender difference is very clear, especially in Italy. There is a specialistic report, the Global Gender Gap report, in which we can say that among not only European countries, but in all over the world, the Italian position in this field is very, very low. We have at half of this special report, and we hope that this trend should be improved in the next year. So when we approach, we can analyze the skill competence, analyzing almost different fields that in the past were summarized in the so DESI report that every year make a sort of radiography about the situation in each country. And we are improving data year by year, but we are at the moment too far from the best country in Europe. Which are these 5 fields that we have to analyze? Communication and cooperation, education on information and data, safety, capacity to solve the problems, and finally, capacity to create digital contents. So in these 5 fields, we know that 60% of the people among 16 to 24 years is much more digitalized, we can say, against the only 20% of people aging between 65 and 74. We know, in conclusion, that it's obvious that the digital competences are much more distributed in young people. But for instance, if we want to analyze the telemedicine, we know very well that the telemedicine is a very strong tool, especially for elder people. So we need to help these people that we have saw that are the people with much more difficulties in the field of digital competences. The end of the project is 2030. All countries are delayed to obtain the results. So, as Professor Sigurello told just a few minutes before, only the cooperation between all the countries could be helped to reach this very, very important objective that is very distributed in all the field of our life, in the work, in the school, in the instruction, and in the, we can conclude, in the participation in our democratic life. Thank you.
Thank you, Professor Pellicano, with this your speech. I think after your communication, I think the priority of our group could be the education aspect, to not to the citizen, of course, but beginning from the health operators, health professionals, ICT professionals, health operators, doctors, nurses, and physiotherapists, and so on, the technicians in the medical field, where we can learn to this kind of operators the different application, the relevance, the importance of the sensors, of the systems, of the ICT system for telemonitoring, for telerehabilitation, for integration of health hospital information systems, and at the last period, even education on the opportunities and of the risks, even of the artificial intelligence in different applications, and in particular, artificial intelligence in medicine. I think our group could start this year or next year the seminars, schools, webinars, masters, advanced, basic and advanced courses about the ICT in medicine. We work in this field since many years, 40, 45 years, for someone less or more. But at the moment, it's important to continue with education proposal in the hospitals, to the universities, proposal our experience, our preparation in this field. I suggest to take part of the faculties of the group for education and to propose this first level of our group mission, education and learning to young researchers, young students, young doctors, young nurses, and so on. The second aspect is to suggest and to prepare at the international Mediterranean level some cooperation projects, network between hospitals, networking between researchers in the field of artificial intelligence in medicine and telemedicine. You see, I think it's two aspects: research, innovation, and before the education support, in order to introduce this system, digital systems, in the health and medical field. What do you think, Samayad? What do you think, Gianni Pellicano, Samayad, and the other colleagues? To start with education.
This is I think, the crucial point. In my experience, I have tried, for instance, to make some lectures in my faculty about telemedicine, no? Because it's quite incredible that after 6 years of faculty medicine, a doctor can get out from the university without any competence in telemedicine. And telemedicine was, I think, one of the most important lesson that we learned from COVID disease. Before, when we spoke about telemedicine, we were in many cases people that was considered a sort of a dreamer, or people that want to spend a lot of money to have the computer in the house of the people and so on. During COVID disease, we realized how this tool is this instrument is so strong in many cases. So now telemedicine is the most common tool that our politicians want to use and want to implement in our health. But there is no lecture, no lesson, no medical courses about telemedicine among the official university lecture, even if a student has to study for 6 years almost in Italy in that.
Thank you.
I try to do so. The role also of our association in this 25 years was to create a lot of seminar, a lot of webinar, just to try to teach this to the people, and especially to the health operator.
Thank you, Gianni, because we are in front now again to the coronavirus pandemic. In Italy, in the last month, in the last weeks, we have a growing of this infection, but no, it's not terrible as 3 years ago, 4 years ago, but a lot of people are involved in the new variants of the coronavirus pandemic. Thank you. We must go in education, and application of the system. And
Okay.
Sam, thank you.
Yeah. Hi, Dr. Scarollo.
Hi.
Nice to meet you again. For me, in our experience in Egypt, the importance and the awareness of the digitalization of everything, including the telemedicine, and specifically in my specialty, the telepathology, is markedly growing. Can you imagine that the last 2 years, all the conference organized in the Egyptian universities, the theme of these conferences was about telemedicine and the application of artificial intelligence in medicine in general. For me, in my specialty, we began our cooperation, as you remember, maybe more than 20 years before.
20 years ago.
Yeah.
21.
In making our cooperation, it was the beginning and the milestone of all the projects coming after. Nowadays, we established a unit for digital pathology. Maybe it was established about maybe 15 years ago, using the machine called the whole slide images, which change or formatting all the slides in a digital form. This was the actual beginning of the application of digitalization in pathology. Since that time, we made a lot of projects in the two sectors you mentioned. The first is the cooperation between my country and more specialized advancing countries in the European countries. For example, I had more than one project, one with you and one with Venice, and another one with Dr. Klaus Kaiser in Germany, and a very successful one with the United Kingdom in Leeds, and we make a lot of cooperation. This is for the teleconsultation, and we published all these studies, and it was also introduced in many conferences. For the e-learning, we changed the whole material for teaching pathology for our undergraduate students to be digitalized. And we have a website, so I can send you the links. It's free to see how we introduce all our material for teaching pathology, either the slides or even the gross specimen, to be digitalized and available online. And the acceptance of the students was amazing. from the early beginning. We began this experience in 2013 and 2014. From the early beginning, the first year, the acceptance was about 90% of all our medical students were using this technology. They found it much easier for learning and for gaining the experience. So we have a good experience in that, and we already trying to change all the teaching material we have, either for the medical students or for the postgraduate, to be available in the form of e-library, including part of our pathology treasure of slides. So I think this is not an idea; it's a new era, and I think everything will change within the coming few years to be fully digitalized.
Yes, thank you very much, Professor Ayad, because now is the just period to introduce strongly the telemedicine in different fields, in particular in diagnostic, as telepathology, telecardiology, teleradiology, or diagnostic based on imaging. It's a very biomedical imaging, of course. I think this is very important to introduce this system in education, in learning, even e-learning, but to support in this period after the COVID pandemic emergence. Now we are in a good situation, even if the pandemic is underground in this moment. We can propose to at the horizon level, for example, next year or this year, after the call of the European Commission, propose some cooperation project. The second proposal is about cooperation courses, cooperation master, cooperation webinar involving different level of health operators, courses for doctors, courses for nursing, or for technicians, in order to improve the ICT in healthcare, digital care, and telemedicine in different fields. In particular, inside the hospital for teleconsulting, telediagnosis, telepathology, telecardiology, teleradiology, and between hospital and territory and district, telemonitoring for chronic disease, for example, diabetes, cardiological disease, neurological disease, and using, stressing courses for the new class of devices, of sensors. We are in front of a lot of new medical devices, digital medical devices, in particular biosensors, useful in different fields. In order to acquire data for the body of the patient, critical life data, important data in emergency or in chronic disease. It's important, this proposal, to educate the people, the nurses, the health operators, to use very well these systems, these biosensors inside, incorporated in ICT platform. This is two fields of our lines. Education, the main objective of our meeting now and after, and the other line is about to suggest, to propose this telemedicine services, new telemedicine services new telemedicine systems, now based even on the intelligent algorithms using new tools like ChatGPT, GPT version 3 or 4, and other rank brain, and the other of these tools in artificial intelligence. Thank you again, Ayad. Other
Thank
comments?
you.
Professor De Felice, Emilia Forlani, Nevin, please.
Okay. First of all, ciao, Spirello.
Ciao.
Very happy to be with you, with all the eminent professors. I strongly agree with what you said and what the other professors mentioned, and of course with what Professor Ayad said. We are in great need in Egypt and in the Arab countries for these education systems. So, as you know, we had some conversations before together, so as to tackle these points, and I strongly suggest that we work on kind of an action plan, because as you know, and as you mentioned in the beginning of this meeting, that we are talking about education to all the stakeholders. So it's kind of enabling the youth to make use of AI. Especially now in AI, we're kind of working on the second stage of the national strategy of AI in Egypt. And they're working on 6 pillars. And one of these pillars is capacity building. So now the country is looking for cooperation in this field. So what I suggest is the following, if you allow me, that since we are all here specialized in this field, that we can work on having one program, let's call it program. It doesn't have to be a master, because here we're talking about more or less training, not education. These medical doctors and nurses and head nurses and so on, they already have their degrees, but they do not know how to benefit out of the emerging technologies. So this can be kind of our objectives, to make the awareness and to make them benefit, not develop the system, but make use of the system and benefit out of the system. And the point that you mentioned, the risks, that is very important, that we should tell them the pros and cons of using AI technologies in healthcare. So if we can have kind of a short program or a short course, but it should be accredited from a university, let's say from Italy, and I don't think it will be a problem, since it's not a master's, but it's a professional diploma. Let's call it professional diploma or professional certificate or professional program. Let's see how you function in Italy. If it's the same like in the Egyptian system, then when we say program, then it's okay. It's much easier to get the accreditation. And it can be taught using Egyptians and, of course, Italian or Europeans, let's say European professors. So the course may be hybrid or online, and they can go for a visit to one of the hospitals in Italy and see how the system is implemented, so as to see how to implement it here in Egypt as well. So this can be kind of an action plan to work on. And meanwhile, maybe we can have like the other entities, like the ASCO and like the ESO, because I delivered many talks with them. Maybe we can work on having an agenda to have one webinar per month. And this webinar is only for 40 minutes, the presentation, and then you allow 20 minutes for the questions. But then we will have more people to join the EMIT with us, which is good to have more members, and we will be able to know the needs of the healthcare professionals worldwide, so as to have more cooperation opportunities. Another point is now UAE and Saudi Arabia are kind of competing in this field, and they want to implement AI in their hospitals and in their systems, and they're doing a great job as the government. There will be an event in September. I got to know this because I'm invited to go there and give a talk. So why don't we start kind of attending or participating, at least one person representing the entity, maybe yourself, Sicurello, so as to explore the opportunities, especially that they already have the funds, they already have the ideas, and they want to cooperate with experts. So what's lacking here is only the experts, and we are the experts. So I think we should be attending more events in Arab countries and in Africa, because now, as you know, all the funds are targeting AI in healthcare and special needs and rehabilitation and all of these fields that you are already specialized in. And we can prepare, maybe I can do this job with Professor Ayad if he wants, we can prepare kind of an outline for a program and kind of an agenda for the rest of the year. So as to have 1 hour webinar, it will be a good opportunity that we meet each other, which is important, and to expand our membership so as to include more people. I think that's what I have in mind. Today I was on air on TV speaking about the governance, AI, and healthcare. Tomorrow I have a full program for 1 hour in one of the very important channels, again, talking about AI in healthcare and the different challenges and the capacity building. So I think it will be a good point that we do it as EMET now. Thank you.
Thank you, Nevin. You spoke to me last week about possible courses, webinars, even for other countries in Middle East and even in India. Yes, we can cooperate. We must cooperate in this education aspect, preparing at European and African cooperation or bilateral countries cooperation. Thank you very much. Professor De Felice?
Yes. Hello to everyone.
You want to say
yes,
your opinion?
My opinion. So, first of all, thank you for inviting me to this platform. It is very interesting, in my opinion. We already discussed it in Siena on May 3rd and the 4th about the importance, the need of the awareness about ICT and digital health in medicine. Digital awareness in medicine, especially so. Professor Pelicano told us introduced very well the points, because democracy is another very important point. So digital health is is not only a professional competence, but also a tool for democracy. And so networking, as well as education, as Professor Sicurello said, are very important points. And I would like to just to underline that there is a country gap, as Professor Pericano and Nevin, Ayad, and all the others, and Professor Sicurello said, yes, there is a gender gap, there is an age gap, but I would like to underline that there is also a disease gap. Because, for instance, disability, poor people, or people with rare disease are very, very important to be connected by this kind of technology, emerging technology. We just published, as Professor Sicurello knows, a paper on the importance, the relevance of telemedicine, so wearable sensor devices.
Sensors.
Yes, in a very difficult to explore disease, such as Rett syndrome. And so this means that probably not only democracy, but the knowledge, the research will really much benefit from this advancement. So I totally agree with the two lines. So not only reaching different countries, different fields, but also different operators, as Professor Sicurello said, because the nurses, technicians are very, very important. And I'm very excited about what you said, Professor Ayad, some about the digital pathology, and we had a very, very nice example of this in the May Congress in Siena. And I'm very excited about this point, and I think we have to push more, is my conclusion, about the residents, medical residents, because not only medical students are very little aware, in Italy at least, about the importance, the relevance of AI, algorithm, and so on, but also medical residents in different specialties, such as my own, so pediatrics and neonatology. So I do believe that we have to push more efforts, as Dr. Nevin said. So we have to plan more seminar, webinar, education, not only in Italy or in Mediterranean countries, but also outside Mediterranean countries. So I think this will be the near future. Maybe is already the present. This is my opinion.
Thank you very much, Claudio. Very important your experience in this rare disease like the Rett syndrome, where the telemonitoring is an important element for to acquire data, and after this acquiring of data, it's possible to change disease, to understand better the disease, and so to suggest new therapeutical
yes. Hopefully,
protocols.
Professor
It's very
Sigurello,
important.
yeah,
It's
but
very important. This is
hopefully,
your experience.
yeah, thank you. Well, hopefully, I think I like to talk to all of you. It's important to change the trajectories of the disease. We have to change the pathways. And I think we are able to do that because the technology already exists, or if doesn't exist, can be very close to exist. So I think education and research should be very good twins in this endeavor.
I think I suggest you in your field, the medical field, to introduce the artificial intelligence. Maybe we can discover more knowledge about this terrible disease. Thank you very much.
I do fully agree.
Thank you very much. Emilia, do you want to say something? Professore Forlani?
Francesco?
Vuoi dire qualcosa?
Sì, allora, thanks Francesco, but in this session I only attended as a listener. So I thank you and postpone my speech as speaker until the next meeting. But I just want to say that here in Salerno we have an international cooperation program with Senegal, and there could be important developments in digital medicine, also in the field of animal health. And then thanks and greetings to everyone.
Okay, thank you very much. We see maybe next week with the Professor Ritrovato, very expert colleagues using artificial intelligence in medicine. Thank you.
Okay.
Thank you, Emilia. Professor Gopal.
Yes.
And
Good
after
evening.
we close this session. Okay, Gopal?
Thank you.
From India.
I teach computer science at the College of Engineering, Guindy, Anna University, Chennai. Been with technology for quite some years until early 2000, when I had to switch to healthcare. And I know the value of technology into the healthcare. We did a course with Apollo Telemedicine Foundation on medical instrumentation. And we have always been thinking that we can do a remote control of medical instrumentation, where there are ways with the shortage of manpower. We can get the most advanced instrument, we can get a most advanced apparatus and equipment, but we don't know how to operate them. How many courses can be run? By that time, there were very good number of hospitals. So therefore, we were thinking that there will be some remote control help. Somebody will guide, some monitoring, because patient life is very important. So that's how those ideas began to get into our ways of thinking. Been interacting with very good number of professionals, and I myself have gone to Ramchandra Medical College over weekends to understand a few things. Now, as days progressed, telemedicine happened. Myself, I have been talking about a possibility of designing some good algorithms for reaching out easy healthcare medicines. The crux in an algorithm is we find it very difficult to verify and validate. Best of the computer science methods find it very difficult. It works. We can get working solutions. So what if something bombs? Every life is important for us. Every time when we are trying to heal them, it's very, very important. So what if something there's a snag in the middle? Is there a way of getting to the patient in quick time? Difficult question. Therefore, we keep making a modest statement. We are only looking at no assurance on end-to-end control. From my end to the patient end, I will not be able to show a complete control path. Like we do it in a hospital, the doctor rushes 2 minutes wherever they are, whether they are at home, wherever they are, within few minutes, you'll get a medical person going in. Otherwise, they are on medical instrumentation. Some monitoring is happening. Any change in the pulse rate, immediately there's a quick attention. We will not be able to assure that. That's one problem. I work in the area of traditional medicine. There's my choice, my advice. We had people like Professor Kalam and Dr. Balamurali Krishna advising on this. We do see that is faith-based and nothing more than faith. Faith shakes mountains. And at the other end, if the faith is something which is different on a remote mode, we do not know. There may be some flippers, unforeseen concerns, which may lead to a slippage which is not intended. I would stop there. We need to think of better solutions in taking the algorithmic approach, and how do we make verification happen, how to make end-to-end control happen. But definitely we agree with you that there is a need for good education. We can get best of the instruments, but who will operate? That instrument is completely underutilized because the people do not have the required skill set. I will stop here. Plenty of opportunities, a lot of work ahead. Thank you.
Thank you very much, Gopal Tadepalli. Thank you very much. If you are agree, I try to summarize to our webinar in a short time, in next week, in order to share with you some ideas of this seminar. Professor Kuhn apologized because he is traveling in USA, and even Professor Tonellato. And I try to summarize some ideas, some proposals, some in order to share comment and arriving for next after the summer time to continue as Nevin asked before, to introduce some education courses and some research project. This is in different field where it's possible to improve the cooperation in research development aspects, and even in education field. Thank you. Any comments? Otherwise, we close this webinar, and I send you a summary of our conversation. Are you okay?
Thank you so
agree?
much.
Yeah,
Yes,
okay, thank
yes,
you.
yes.
Thank you very
Okay.
much.
Thank you so much.
Okay,
Thank you so much.
Nevin.
Thank you
Ayaz,
very
Pleasure
much.
meeting you
ciao,
again.
e Sam.
Thank
Bye.
you, Dr. Sikorel.
Thank
Bye.
you.
Bye, bye,
Bye.
bye. Ciao.
Ciao.
Today we had a very long seminar in presence workshop about the environment and healthcare risks in the hospital. I am at the moment in the hospital in Desio. Do you remember, Nevin, the Desio hospital?
Yes.
And I had two, and the
Yeah,
media
for
too,
sure.
this
For
hospital. I
sure.
am here, and
Yeah.
now we are remaining only 5-6 person, and we go at home. Thank you very much.
Back to you,
Thank
Sikorel.
you.
Thank you
Thank
so
you.
much.
Thank you.
Bye, bye.
Have a
Ciao.
nice day.
Thank you.
Ciao, ciao.
Ciao.